Hi YouTube, FJP VSG here. It's been about a month since I've posted my first video. This is my second video. It is August 13th, 2014. I had my pre-op consult today with Dr. Matthew St. Laurent here in Houston, Texas, and he is a phenomenal doctor. I know he's not touched me yet, but he's actually operated on several friends of mine who've had fantastic results. And this is actually my second time to his office. I went last week and had my my psychological evaluation done. I passed with flying colors, so I guess I'm only partially crazy. But so today I met with him. My appointment was at 8:30 this morning. He sat with me for almost 2 hours and spoke to me. That to me is unheard of nowadays. Normally you can't get a doctor to stay in the room with you for more than 10 minutes. And he sat and conversed with me for almost 2 hours. He put to rest a lot of questions that I had before I even had a chance to ask him the questions. He was very, very thorough, and he made me feel as though and reassured me that the decision I'm making, getting the VSG for myself, is the best option for me. Because because of the weight I am and the height I am, and the way that I hold my weight, he says, and I don't have all these other health issues, that the VSG is the best option for me. So that was great that he thought that I was making the right decision, that I chose the right bariatric surgery. So I went in there with a list of questions. Didn't really have to ask him very many because he had kind of answered them anyway. And the questions that I had were kind of ones that I had found over the time of my research, that were suggested to ask by other sleevers. And I found it really informative to ask these questions. And like I said, some of them I didn't even have to ask because he answered them while we were just talking. So I went in with my little notebook, and he's done over 1,500 sleeves in almost in like 6 years, which is fantastic. All of them have been laparoscopic. His complication rate is less than 1%, and he has not had anyone die from having the VSG, which is reassuring as well. He has a leak rate of 0% on new patients. He has a little bit of a leak rate sometimes on revisions, he says, but that's very rare as well. I asked him if I'm going to go home with a drain. He said absolutely not. None of his new patients, new sleevers, go home with a drain. Every once in a blue moon, he said that a revision surgery will go home with a drain, but not a new one. I asked if there were complications that arose after I left the hospital and I was home. After hours, was there going to be somebody on call, to answer my questions? And he said he is the one on call at after hours. You call his office, it goes to a call center, and it actually goes to his cell phone. So that is very encouraging. The only time it's not him is when he's on vacation, and at that point it's his nurse practitioner, who is also in constant contact with him, so that she doesn't make any decisions without him knowing. So that's reassuring as well. I asked him what size Boget does he use, and he used the 34, which is right, the size that majority of us all have. He says most of the time he uses the 34 unless it's a much larger male. Sometimes he'll use the 36. If he said it all depends on the length of a person's stomach. So if you have like a 7-foot tall person, obviously he's going to utilize, he said he's utilized like a 32. And someone that was extremely tall, who had a longer torso, who had a longer elongated stomach, so he just made it skinnier and longer, which makes sense to where it's, the hole is the same amount of food. I I also asked him how my sleeve is going to be closed. He said it's going to be closed with staples, and he does not oversew on top of the staples. He makes a really tight sleeve. And so on top of the staples, he puts like this sealant, for a lack of a better word. He told me what it was, but for the life of me, I can't repeat the word. I have no idea. So it's basically just to seal over the stitches to ensure that there's no leakage. So that was pretty much my main major questions. I did ask him about time off of work. He said it all depends. Every person's different. He said after a week you may feel like you can go back to work. He said you're just going to be extremely tired. And he said it really all depends on what your job allows you to do or not to do. So from that, I had kind of always from the beginning thought that I was going to take about 2 weeks off. And he said that seems very reasonable for me to get past the liquid stage. So when I return back to work, I'm kind of on soft foods. So that made me feel better because I'm not really telling anybody at work that I'm doing this. It's kind of going to be like my dirty little secret. So when I return back to work, and I'm 10, 15 pounds lighter, I'm going to have to come up with some kind of excuse. Like I've been on this binge diet. I don't know. It's none of their freaking business anyway. So I do have a handful of people that are really, really close to me at work that do know, and they're so excited for me. And so I go back to the doctor's office on the 21st, which is next Thursday. And I meet with the nutritionist, which is just another part of the the pre-op situation, to go over the pre-op diet, etc., etc., etc. On the 15th of September, I go in for my pre-op testing. It's 2 tests, one that is required by my insurance, one that's required by him. So the first one is the one that's required by him. It's a transnasal esophagoscopy. Basically, it's a transnasal scope where they put a tube down my nose to go down my esophagus, make sure there's no esophageal erosion from acid reflux, which my acid reflux is not that bad, so I won't have any issues with that. And then they also look for hernias at that point too. So that's one. The next one that I'm going to do the same day, is a cardiopulmonary metabolic exercise test, also known as a cement test. They have different nicknames for everything these days. Basically, it's just I'm gonna have some little sticky nodes on my chest. They're gonna put me on a bicycle and I'm gonna ride. They're gonna test my cardio activity, and so that's on 9/15. It's about a 3-hour appointment. That's a really long appointment. So I guess I'll be working from home that afternoon. So the next step after that, September 23rd, I joined the Losers Bench. In 40 days, I joined the Losers Bench. Insane. I'm so excited. I'm so nervous. There's a list of things that I think I have to do before then. Like I want to get some oyster forks. Just those little bitty cocktail forks that I think will help me eat much smaller bites when I'm ready to eat. I'd also like to get maybe like a little baby spoon, in the beginning, for the beginning. Excuse me. And I'd like to get some little smaller bowls or smaller plates to just kind of help me reteach myself how to do portion control. So, but again, I have plenty of time. I have 40 days to do that. So, Ross, TJ Maxx, Marshalls, Tuesday morning, just in case go shopping, right? Except I'm not buying any clothes. I just refuse. So, last time I posted that my mom was not really on board with this. And she's really came around. I called her today after I met with the doctor, and she was really excited for me, and I know she's going to be here. I know she's going to be very happy for me, and I know she's going to be one of my main supporters. So I'm really not that concerned anymore. My sister's going to come a couple of days after surgery just to kind of get me out of the house. So I'm not, bottled up in the house for all of 2 weeks. So she goes on vacation a day or two before I have surgery, and then she'll come visit me a couple of days after. Um, then kind of get me out of the house, get me moving a little bit. So I think that's a good idea, because I can't stand to be at home for longer than a few days, because 2 weeks home I'm going to go batty. So, I mean, it's just unfathomable to me that by Christmas, so September, well, October, November, December, that's 3 months. That's just, I just can't wait. I've been anticipating this so much. I've created like an Excel spreadsheet. So it's all calculated and formulated. Yes, I'm an Excel nerd. So basically, every week when I weigh in and measure take my measurements, I put in the week. Well, I'm gonna have, from the date of surgery, what my measurements and weight was, and then each week I'm just gonna go and then put that week, so that at the end it kind of just totals it up, and at the bottom it kind of totals up total weight loss, total inches, blah blah blah. Yes, I'm a nerd, but it makes me accountable, and y'all make me accountable. Knowing that I have a couple followers that maybe are interested in what I'm doing and how I'm doing, and to me that's a huge support. And y'all make me accountable, because I don't want to keep y'all hanging, and I feel terrible because I haven't posted in a month, but I didn't really have anything to post till today. So I just want to thank y'all for being there, for helping me be accountable, and for being there, and being a form of support for me, because none of this is easy. None of this is an easy decision. Yeah, it would be so much easier just to stay the way I am, and just get bigger and bigger and bigger and more miserable and more miserable and more miserable. So, but why? Not why, when I have the option to have this tool, and to start a much healthier life, to build a healthier me, to become half the person I am physically. Because realistically, the amount of weight I need to lose is a person. I mean, I want to lose 130 pounds. That's a freaking person. That's like insanity. That's like my 12-year-old nephew. It's mind-boggling. But I know I'm going to do it. I know I can do it. And I know that I have a support system through y'all, through the support groups I'm with on Facebook, to my family, to my friends, and with the staff at Dr. St. Laurent's office. I mean, that's all support, and that's all people have to be accountable to. But the most important person I need to be accountable to is myself. And I want this so bad I can taste it. And it's so exciting. It's so exciting. Um, Again, I always say this is not easy. This is not going to be easy. I'm not expecting it to be easy. I'm expecting it to be, in the beginning, really hard. You know. But one of my favorite mottos is that I have this in my bathroom, which really doesn't obviously help very much right now, but nothing tastes as good as skinny feels. So, and it's so funny. I had to laugh the other day. My mom texted me this really cute outfit, and she's like, "Look how cute this is. Do you want it?" And I'm like, "I don't plan on buying any more clothes." And then even after surgery, I have all these variety of sizes in my closet that go from 22 down to 18. I'm fit for a while. I don't need any more clothes. And if my clothes are a little baggy at work, then they're just a little baggy. And until then, I'm not gonna buy any, really good clothes like I normally do. But it's okay, because in the long run, I'm gonna be able to buy much smaller clothes, much cheaper prices, much cuter clothes than what I've been wearing, and that's all worth it. So I'll repost again next week after I meet with the dietitian. So I planned my last hoorah. Basically, it's like my going away party for fat me, and it's gonna be the weekend of August 30th, so Labor Day weekend, and I'm going to LSU Wisconsin season opener here in Houston. I have 4 seats. we bought them a few months ago. And I kind of started thinking about doing this, but I had no idea it was going to be just a couple weeks after that I would be having surgery. So this is going to be like my last hurrah before I kind of start my pre-op diet, which for this doctor is not strict liquids. Thank you, Jesus. For 2 weeks, this is just a high protein diet, just to help strengthen the liver. So, but it's just a modified diet. It's not liquid. So I'm grateful for that. Because having liquids for 2 weeks after surgery is going to be hard enough, especially 2 weeks before. But anyway, so I'm really excited about my last hurrah weekend. Being able to eat and drink whatever I want before I go on to my pre-op diet. And it's okay. It's okay. Because I know eventually one day I'll be able to eat a little bit of those things later on. I just have to learn that I have to learn how to eat properly. I have to learn portion control. And my sleeve's going to help me do that. And I think I'm going to try to name my sleeve. Is that weird? Because I've seen people like in some of the support groups that have a nickname for their sleeve. And because realistically, you can't say you have a stomach anymore because it's not really a stomach. I mean, it is, but it isn't. So anyway, I know it's weird and kind of off the wall, but that's something I'm going to be thinking about. Is if I want to nickname my sleeve. So anyway, I've kept y'all for long enough, and I will post after my visit with the nutritionist. Again, I'm sorry I've been kind of bouncing all over the place back and forth in this video, but maybe next time I'll be a little more organized. I can try. But I have to be organized at work. I really want to be organized at home, but I don't have to be. So anyway, keep losing. For those of you who are already in Loser's Bench, I'll be joining you on the 23rd of September. And for those of you who are contemplating and thinking about the sleeve, come join us on the Loser's Bench. I will be there in 40 days. So be blessed, everybody. And I will talk to you all soon. Have a great day, great week. And I'll talk to you. Hopefully I'll post next week. Bye!